All right, so let's now speak to the Western Cape Head of Health, Keith Cloete. Good evening, Dr. Cloete. And, you know, it is worrying. The Western Cape's numbers are now higher than Gauteng's. Western Cape 3968, Gauteng 3665. We've known that Gauteng is over the peak. We've known that for at least a week. The question I suppose I have for you is the Western Cape still building for its peak or over its peak, do you think?
Good evening, Sally, and good evening to the viewers. Sally, I just want to put in context the results that you get, the daily results. And our team works very hard to reconcile them. So what you are reporting and what NICD reports is, let's call it the date of reporting of the test. It does not report the date of when the specimen was taken. So what we do is we normally see a lag between the date the specimen was taken and when the results become available. So what we've done is we've reconciled that 4,000 tests of yesterday, and most of those tests, the specimens were labeled to be taken on Monday. So Monday we've recorded a very high figure of about 5,000 positive cases. So every day we get the test in, we reconcile it back to the date of specimen. But what that 5,000, the team dug a little bit deeper into it. There was a lot of rapid antigen tests that was done by Dis-Chem at the airport as well. And it's not quite clear to us now whether all of that was actually done on Monday or whether there's a backlog of tests that was done as rapid antigen tests and reported as part of the sample. Be that as it may, your question is, having reconciled all of that, we are seeing a pattern where our cases are still increasing, but the rate of increase is slowing. So we've not hit the peak yet. We are entering the peak. We know this from before. It's very similar to what we had in the end of December, beginning of January. And we see it in hospitalizations. We also see it in deaths. So in the Western Cape, we are entering a peak. We've not quite got there yet. The reproduction number is not below 1 yet. That's when we start decreasing where Gauteng was about 2 weeks ago. We expect to get into that place in the next 7 to 10 days. That's why there's quite a lot of pressure currently in hospitals, and our concern is for the next 7 to 10 days.
And one thing that I think is fairly stable, because you're right, that's why it's important to look at the rolling averages. We've also noticed that a Monday is often quite low because over the weekend things change. But the deaths are very worrying. I mean, yesterday it was 520. This latest it's 523. Can you tell me, are most of those deaths still in Gauteng? Because we know even when you're over the peak of infections, you've got at least a 2 to 3 week lag as people start coming into hospitals and then sadly succumbing to the virus.
So again, Sally, we do the deaths in this province, so we account for quite a lot of those deaths. And the reason why it is because we are we're reconciling all the deaths that we have, and we reconcile it with the MRC excess death report. So we look at all the Home Affairs data, we get the deaths in, and our reporting is actually pretty high compared to the excess death report. So again, when we do that and we get the deaths reported on the day, we go back and we see that how many deaths actually happened yesterday, the day before, the last 4 days. So for instance, for the Western Cape today, we are reporting 110 deaths, but only 55 of that happened yesterday. The others happened on days before. And therefore, it is quite important to actually track the MRC excess death report, because that is a very accurate external reflection of really the reported deaths. But you're right, there is at least a 2 week lag between cases, hospitalization, and deaths. And according to the MRC death report for us in the Western Cape, we are starting to plateau out as well for the MRC death report, and we expect that in the next 7 to 10 days as well to start going down.
Talk to me about how your hospitals are coping at this time.
The current situation is that the hospitals are pretty full. We have more than 3,400 patients with COVID in our hospitals. And that is about 1,800 admissions in the public sector hospitals, with about 1,600 in private sector. In our public sector hospitals, our capacity in critical care, which is ICU, high care, and then also on high flow nasal oxygen, is at about 110% in the public sector. So we are fully occupied from a critical care perspective from COVID. Our big concern is, in the acute care and intermediate care, we're still bringing additional capacity on, but the pressure is in critical care. Our big concern is that the restrictions have been lifted for alcohol, and we're going into an end of month weekend, and we're concerned about trauma and the impact that will have on our hospitals, because our public sector hospital will be extremely busy over this coming weekend.
Yeah. Tough times indeed. Thank you very much for breaking that down so clearly for us. That is the Western Cape's Head of Health, Dr. Keith Cloete, telling us that they think they are heading to their peak very soon.